Are ligaments the hidden disability of your personal injury case? In the intricate world of personal injury cases, we often laser focus on the immediate, visible injuries. But there's a silent, less noticeable player that can dramatically change the game: our ligaments. These fibrous tissues, essential for stability, are frequently underestimated and overlooked. Particularly, these ligaments in the spine can cause lasting and even permanent damage. The real challenge? These injuries are often missed in diagnoses, leading to a significant oversight in assessing their long-term impact on a person's life. This can drastically affect settlement values because the true extent of the injury isn't accurately represented. So, understanding the nature of ligament injuries is not just important. It's crucial for both attorneys striving for accurate representation and for the personal injury victim seeking fair compensation. Because when it comes to personal injury cases, ligaments are more than just a supporting structure. They can be a major factor in a person's ongoing struggle. Proper diagnosis of ligament injuries is paramount. This might sound quite obvious, but it's a fact that often gets overlooked. Healthcare providers play a key role in patient care, but equally important in diagnosing any and all areas of involvement of a personal injury case. Additionally, attorneys play a very crucial part in advocating for the patient as well. It's important for attorneys to be aware of the potential for ligament damage and its long-term effects. Remember, it's not just about what can be seen or felt immediately after the incident. A ligament injury might be the unknown factor, silently causing long-term disability and potentially altering a personal injury victim's life forever. Collaboration between healthcare providers and attorneys is the cornerstone for accurate diagnosis and fair compensation. These dense fibrous tissues play a critical role in our musculoskeletal system, serving as the binding force between bone to bone. Ligaments ensure our joints are stable and guide our movements. Now, when it comes to wound repair, ligaments present a unique challenge. You see, unlike some tissues, ligaments don't fully heal. They undergo what's known as wound repair. It's a bit like patching up a punctured tire. It might hold up for a while, but it won't be as strong or reliable as a new one. When a ligament is injured, the body attempts to mend the damage, forming a fibrovascular scar. This scar, while serving as a makeshift solution, doesn't quite match the original tissue's mechanical properties. It's like using duct tape to fix a broken vase. It might hold the pieces together, but it's not the same as before. This process of wound repair, as opposed to true healing, leads to a weakened area that can cause long-term disabilities. When a person suffers a traumatic injury to the ligaments in their spine, it's not a simple healing process. It's a complex journey, fraught with challenges, that can change the course of an individual's life. There are long-term consequences of ligament injuries. They can cause formation of bone spurs known as osteophytes. These are bony projections that develop along the edges of bones, often in the joints. This might sound like a mouthful, but it's a vital piece of the puzzle when understanding the lasting impact of ligament injuries. While osteophytes themselves are not necessarily harmful, they are a clear sign of the irreversible nature of ligament damage. They are the body's way of trying to compensate for the weakened ligament, but they often result in further complications, including significant pain and restricted movement. That pain will affect daily activities and enjoyment of life. This type of injury is a huge component in the overall case that is often missed. Understanding the irreversible nature of ligament damage underscores the importance of proper diagnosis and fair compensation in personal injury cases. These injuries can be a life-altering challenge for the personal injury victim. It is imperative that the healthcare professional work with the patient for proper diagnosing. Additionally, the attorney should be well-versed on the role that ligaments play in personal injury cases to assure a fair and equitable settlement.